I would like to talk to you a little bit about hormone replacement therapy. It is near and dear to my heart because as a gynecologist for 20 years, I helped women through the transition into menopause, and I saw a lot of suffering that we were able to relieve. However, this is also one of my big eye-openers as a gynecologist when it became painfully aware that I had not been properly trained in hormone therapy. You see, traditional medicine and the traditional gynecology thinking is really that the only benefit for hormones is during the immediate menopause transition. And so they say to use any kind of hormones that you want for 5 years, but then get off them after 5 years because of the long-term risks. Now, I have come to learn that the biggest benefit of hormone therapy is actually brain health. We do not want to outlive our brain. We want to have good memory, good reflexes, quick response times. I don't want to be one of those little old ladies driving down the road at 30 miles an hour because I'm afraid that I can't respond quick enough if someone pulls out in front of me. I want to remember why I walked into the room. I want to remember where I parked. I want to know where my keys are. These are all things that are related to brain health and memory. So the brain, your clarity of thinking and your recall is going to be related to how well information travels from this brain cell to this brain cell. And if everything is healthy, then information travels at lightning speed. However, if the cells shrink a little bit, now we have a gap. And when there's a gap, information doesn't travel as fast. And then if it shrinks a lot, now we have dementia, and we certainly don't want that. So the reason that hormones are beneficial is that estrogen, progesterone, and testosterone are like fertilizer for the brain cells and helps to keep them plump and healthy. And then we have better memory, better recall, and much healthier for the rest of our lives. Yes, the hot flashes are important. Yes, we don't want to suffer from them. The hot flashes, however, are temporary. And that is why traditional thinking is that you can get off the hormones after 5 years, because as you get off of them, the hot flashes will no longer be there. But the brain health is lifelong. And that is why I want to use the safest hormones possible and do everything the best way possible so that we are maximizing the benefits and minimizing the risks so that we can stay on the hormones lifelong, because the brain health benefit does not end. So with that in mind, there are 3 components to hormone safety. Okay. Component number 1 is use the right hormones. We want to use hormones that are bioidentical. And what that means is that at the molecular level, they have the exact same structure that the hormones that your ovaries used to make. I don't care if it comes from a lab or a plant. I care at the molecular structure. Is it the same structure that your ovaries used to make? That's bioidentical. Component number 2 for hormone safety is use the right balance. So we want to make sure that we use the right estrogen and progesterone balance. Component number 3 for hormone safety is make sure that we dispose of the hormones in a safe pathway. And that is how our body detoxifies. So the key with healthy hormones is we want to get them in, we want to use them, and we want to get rid of them. And so the only way to know how your body disposes of the hormones is to do a urine study. That is a very easy way to determine by which pathway does your body excrete the estrogen. Because even bioidentical hormones, if they're not excreted in a healthy pathway, could have additional risks. And there are things that we can do to make sure that the pathways are healthy. So periodically in my women on hormone therapy, I will do a urine study to evaluate the way that the body excretes the estrogen. That way we can make sure that we have the right hormones with the right balance and safe metabolism. And if we do it that way, then we can stay on them indefinitely and achieve the lifelong benefit, especially of brain health.